Next up, we have Trihealth discussing why inclusion is important in healthcare systems. Our speaker today is Jeremiah Kirkland, and I will leave it up to you. I want to make sure that I have your PowerPoint up, so give me just a sec. Is this your DEI framework? Okay, great. All right. It's just one slide? Yeah. All right, you can come on up and talk. All right.
Thanks for holding your applause, everyone. Good. Oh, geez. You didn't have to do that for me. Thank you. Jeremiah Kirkland. I am the president and COO for Bethesda Butler Hospital, and I also have the privilege of overseeing our obstetrics and gynecology service line and our women's service line for all of Trihealth. We have a number of outpatient practices. We deliver over 9,000 babies in this region, and I'm really proud, of that work and to be working with Trihealth. Some of the work that I'm really proud of is our diversity, equity, and inclusion team. We've also added belonging to that team because we understand that, God bless you, we understand that in order for to have a great, healthy community, our focus on reflecting that community we serve, understanding the community we serve, understanding the culture, and providing a diverse team is really, really, really critically important. So my commitment and promise to you is that, I really don't plan on spending more than my allotted time, which I'm sure everybody's grateful for. I'll probably be under my allotted time. But when talking about diversity, equity, inclusion in healthcare, I have often found that folks, they have these discussions but don't walk away with any tangible ideas or things that they can do within their respective organizations. So my effort today is to talk to you about what is Trihealth doing, what have we been committed to, and give you a little bit of details on that, and then we're happy to share slides and I'll answer any questions. So what we've started to do, and really it's been a little bit of a journey for us. We've been doing this over the last 7 to 8 years, but really have been more intentional in our focus over the last 2 years. The 5 buckets that we looked at and said we're going to improve in our system are creating a more inclusive culture, recruiting and retaining and developing diverse talent across our system, advancing diverse partnerships, and then reducing health disparities and engaging and embracing key audiences through communication. So I'll quickly, and this is really hard to read, so I encourage you not to try. You may hurt your eyes, but my focus is I'll share what these points are really quickly, and then open up the forum for questions. So under creating a more inclusive culture, we really want to focus on increasing respectful empathy, understanding the importance of diversity, equity, inclusion throughout our organization. So when I mention DEI, diversity, equity, inclusion, somebody give me a couple of words or one word that you think of when I talk about this topic. When I talk about DEI, diversity, equity, and inclusion, when you hear that topic, that discussion, or even this PowerPoint, what are your initial thoughts about that? What comes to mind immediately? Fear, okay. Acceptance, okay. Other words. Inclusion. Okay, inclusion. All right. Belonging. Okay. So when well, thank you for those who participated. I wish I had a gift. I usually come with gifts. I didn't come with gifts today because I ran over from another event at the West End, but I promise I'll have gifts next time. So usually when we talk about this topic, right, some folks have shared with me, this is an immediate discussion about race, right? We're going to talk about race, and this is uncomfortable. Some folks may be fearful, but diversity, equity, and inclusion is a lot more than race. Even when you talk about the word diversity, when you talk about gender diversity, diversity in cultures, religions, backgrounds, what people believe in and experiences. So differences is what we really need to embrace. This is not just a discussion on race. When you talk about equity, there's equity in pay, there's equity in how people are treated, it's equity in the workplace that goes much deeper than race. And then inclusion. Inclusion has a number of areas that we need to focus on, and I'll dive into some more But education is what we've been focusing on at Trihealth to help people understand when we talk about DEI, diversity, equity, inclusion, and belonging, it means a lot more than what's at the surface and what some people may have initially thought. Our next focus for ours is implicit bias. We talk about implicit bias and cultural competency. By a show of hands, who in here believes they have bias? I would hope everybody's hand in here went up, unless you just kind of weren't paying attention to me, and that's okay. I'm not mad at you, but that happens. But we all have bias, right? And bias isn't necessarily a bad thing, but I think that we naturally look to categorize things when we see things and make decisions. Is this good for me? Is this bad for me? Should I engage? Should I step away? Fight, flight, fear, all of those things come into play. So we have education and training around implicit bias, cultural competencies, important things that need to be happening within our system. The next thing we talk about is leveraging, employee resource groups in areas where folks can go to have, open discussions. We don't promise that every room is going to be comfortable. We don't promise comfort. I even have a friend of mine who shares with me. He's a personal trainer. He said, Jeremiah, similar to some of the work you do, get comfortable being uncomfortable. Some of these discussions are uncomfortable. We're getting down to the root of who we are as human beings, what we believe, what we think. So it's important to be able to step into spaces you can have those conversations. The next thing I'll jump down to is reducing health disparities. It's important that as an organization, we're collecting data to understand and break that data down by race, ethnicity, and preferred language. When people come into our organization, we should understand the people we're serving. We also want to make sure we have robust staff and technology to help us make sure that we're communicating with patients as they come into our buildings across Trihealth. The next thing is identifying and measurably reducing health disparities by service line. So we're digging into each of our respective service lines and saying, where are we finding there are disparities in care and we're not getting the same outcomes or better outcomes across different specialties. So that's some of the work that we're doing. But it takes good data to figure out that work. Our next focus is recruiting and retaining and developing diverse talent. A couple of things we've done at Trihealth. We've created a program called School to Work. We've invested $15 million in building an endowment in partnership with Cincinnati Public Schools to hire 50 diverse students and students of color into Trihealth and have them work in our different departments so they can learn. In over 2 years, we pay them as team members. They build a great resume, build great relationships, and we help inspire them to get into healthcare. And 75% of those students on average go on to pursue careers in healthcare because we know we need more physicians and providers of color in healthcare. We also have a specific focus on increasing our minority hiring rate for leaders of color in our system. And again, our efforts to make sure that our workforce reflects the community we serve is vitally important, so we're continuing to do that work as well. The last two areas, one, advancing diverse partnerships. We want to continue to increase our business spend with women-owned, veteran, and minority-owned businesses. So we went from spending about $7 or $8 million with these businesses and institutions to a little over $16 million in 2 years. So seriously making a commitment, putting our money where our mouth is, and making investments in these minority-owned businesses. Very next thing, developing partnership with agencies, different professionals, healthcare agencies and community agencies to make sure that we're addressing something called social determinants of health. Anybody want to take a shot at what social determinants of health are, or give me some so you
Grew up in a poor area of town, connected to someone else, within miles of each other.
Yep. Yeah, so that's accurate. So social determinants of health also include, what things that involve your socioeconomic status, things that impact your environment, transportation, food deserts, a combination of things, housing inefficiencies, and a combination of things that really affect or impact the health outcome of the people that we serve in a community. So finding ways to make sure that we address those issues as well, because as a health system, we can't do it all. We need good community partners to help drive change. And then lastly, engaging and embracing key audiences. provide opportunities for team members to share their personal stories, committing to advancing DEI work, incorporate the consumer, listen to your patients' voice, give them an opportunity and a platform to share their concerns, what's bothering them in the community, what would they like to see improved. And then lastly, identify, again, key partners that help reduce really these social determinants across the board. So this is some of the work. Again, I don't want to keep this stuff a secret. We want to share it because we want organizations and institutions to be a part of it. If you take one thing from this and say, hey, maybe we're going to try this, maybe we'll look to implement it. And if you want to reach out, you have questions, I'm happy to share what we're doing. But if every organization in this community said we are going to take a shot at really trying to change the population health and increase better health, better wellness for everybody, despite income, despite background, I think we'll be a better community for it. So that's my story. I think I kept that under 10 minutes. You did. Any question? You guys can clap. No, go ahead. No, I'm joking. Yes, questions?
How are you measuring your outcomes?
So that's
doing all of these things. How do you measure if you're successful or unsuccessful?
Yeah, so that's a really good question. And I would encourage all of you to, usually when I say it's a really good question, I don't have an answer. I have an answer, I promise. I would encourage all of you to don't just do feel-good programs because they feel like they're the right thing to do, but you don't measure what you're doing. You don't have specific data points connected to what does success look like, what does failure look like, because you could invest a lot of money and not see any of the return, not have any of the impact. So there's a couple at each of these points we've outlined here, we have something to measure what success looks like. For example, the School to Work program, we said we want to hire 50 students a year. We need to successfully hire 50 students a year. We want these students to get through the program, and we want at least 65% of them to look to pursue careers in college in healthcare as they go on to college. And we want those students to go into targeted areas where we need more healthcare professionals, where we need nurses. There's a huge shortage in radiology techs. We need individuals to go into these programs. So our goal is to track that and measure what success looks like over 2 years and 4 years. Other programs that we've put in place, let's take into account the data collection around race, ethnicity, and language. We know what we have as a baseline today in the system with how many of the thousands of patients that we've seen, how many of them have we collected any of those demographics on. And I think when we first did our numbers in our review, we probably had 5 or 6% of collection on our total number of patients in the system, because our registration team was kind of just bypassing that information, and then we didn't have specific call outs or I can't remember the word for it. My EMR brain is a little scrambled, but we need specific discrete fields of information where you can call that out and then run a report on it. So we said we have to put those things in place, and we have to look at some of these metrics. Two big metrics in our system are we hiring more diverse talent and more leaders of color into these positions of leadership that we have? So we have a measurement. Our goal is 20 to 25% every year. So we measure that, and we tie that back to our bonus and financial incentives in the system. We also know that we don't have as diverse of physician population. So this year we put that metric in place to say that we want our physician population to really mirror the population of patients we serve. So we said we're gonna take the total number of patients we serve, and we break that down by race and demographic, and then look to make sure we hire that and have recruitment tactics behind supporting those numbers. But the measure, we probably spent 7 or 8 months just figuring out what's going to be our dashboard to measure all of the things that we said we want to do, just so it's not kind of that feel good work. But very good question. Thank you. Any other questions? I think I have another 30 seconds. Yeah, so we have, I'm glad you brought that up. We actually have applied, and we've received some grant funding through Bethesda Inc. and some other grant funding arms. And they were very specific on what outcomes did we plan to produce, and what outcomes did they want to see after a 2-year period or 3-year period. And you certainly are, if you have not met those goals and lived up to, if there's good reason, pandemic, other things that come into play, I think they're understanding. But if you haven't were clearly defined, those measures, and really met and exceeded some of those goals, that they won't give you the financial support. So that's huge, it's key. I think anybody that's doing some of this work, make sure it's measurable. I think I can take one more question.
How do you access the school work programs?
If you go to the thank you for bringing that up. If you go to the Trihealth, trihealth.com, Trihealth website, our School to Work program is on the website. We're actively recruiting from 3 Cincinnati public schools, and we are expanding to 7 total schools starting in January. So I think it's a great program. And my personal testimony is I was involved in a program like this 22 years ago, which helped me get my start in healthcare. And many of the students that graduated from this program in Western New York really have gone into healthcare and are leading successful careers and also giving back to the local city school district. So blessed to bring the program here and have it in place for the last 3 years. Thanks, everybody.